The honourable member for Highway.
Thank you, Mr. Speaker. Let's change gears here a little bit. Alberta's clinical information system is badly in need of updating. The current system is over 30 years old and lacks the ability to share information across various platforms. Patients are often left having to explain their health stories to different professionals over and over again. This can lead to mistakes and needless duplication. Wildrose has called for upgrades to clinical information system for years. You know what? And it's refreshing to hear that I think this government is finally taking our advice and bringing our healthcare system into the 21st century. Will the minister confirm that this upgrade is in fact taking place, and if so, when?
Honourable Associate Minister.
Thank you to the member for the question. We haven't yet had our chance to talk about our health estimates, so I guess we'll talk a little bit more about that there. But we are indeed committing funding in Budget 2016 for the implementation and upgrade of the CIS, which will begin. It's an ongoing process, and the work is beginning immediately.
First supplemental.
Well, thank you. Given this particular upgrade has been long promised by successive governments, but has always been scrapped, so the government can forgive Albertans if they're not willing to take their word at this time. Was an RFP issued and/or awarded for this project? If so, when? And when can we expect the initial introduction of the system?
Honourable Associate Minister.
Thank you, Mr. Speaker, and to the member for the question. As I noted, the upgrades for CIS are included in Budget 2016. So as soon as we get that budget through the House, we can begin spending that money. I would also like to note that, unlike previous governments, we make a decision and we commit to it, we put the money in, and we move forward.
Thank you, Mr. Speaker. Given there's no denying our healthcare system is in dire need of an upgrade, at a price tag of $400 million, you owe it to Albertans to ensure this upgrade is done right. Will the minister confirm that a detailed cost-benefit analysis was completed and a market assessment was undertaken? And if not, why not?
Honourable Associate Minister.
Thank you, Mr. Speaker, and to the member for the question. A detailed market analysis, the tender process, as well as a number of cost-containing measures are all part of the bid process that we will be undertaking as part of this implementation.